My name is Kate Zhao, and I have a master's degree in social work, special interest in families and children, specifically like postpartum depression, prenatal depression, as well as, like I said, children. And I also worked in healthcare for 10 years, so background in that as well. Today I'll be talking about caring for children, and then we'll go on touching a little bit about first aid as well. So, what does a kid need to be happy and healthy? They need to eat well, sleep well, play well, learn. They need to feel loved and safe and have friends, friendships, and relationships. So first part is, taking care of their bodies. So what does that look like? With kids, you want them to eat right, a variety of foods, like fruits, vegetables, whole grains, dairies, milk. It's important to have a variety of different foods to make sure they're getting all their vitamins and nutrition. You want a predictable meal time, and you want to eat about the same time each day. Kids thrive on predictability. In fact, there's the concept of boundaries that we often forget about, that children actually do better with boundaries than without. It's not so overwhelming for them. So eating at the same time each day helps them not only feel comfortable in their environment, but also gives them the energy to learn and play throughout the day. Sleep is very important for children. Toddlers specifically need 10 to 14 hours a day roughly. It could be a 10-hour stretch at night, and then throughout the day getting that 4 hours, or however that looks for them. But there should still be a nap time around that time. And then school-age kids, we need about 9 to 12 hours of sleep as well. And especially with younger kids, it's important to have that bedtime routine. So you want to have, whether it be reading books, a warm bath, brush your teeth, that kind of stuff. Something that's really important for children is moving and playing. You want to think about play as their job, right? Like, that's how they learn. That's how they learn different skills, their balance, their interaction with the environment, how to problem solve. That all comes from playing, so it's very important for children to play. Also, to move their bodies. That's how we keep them healthy, moving their muscles and that. So with that, screen time is not bad, but we want to limit it because we want to, again, make sure that they're moving around and getting the exercise they need throughout the day. Also, it's important to get those routine doctor visits, making sure that they have their vaccines and everything is staying up to date with their health. And as well as keep going back to that routine of making sure that they're brushing their teeth, taking routine baths, washing their hair and hands before meals and whenever they're dirty or outside. So what makes the kid feel safe and loved? That's very important for them. And that's just simply being there for your children. That consistency in your care and your love for them. Giving hugs and kisses, showing them how you love them. Verbally expressing it to them in different ways, why they're important to you. Being nice, saying nice things. Children learn to love through modeling. So if you model a healthy, loving relationship to them, they will also learn that themselves. We need a safe place. Just like as an adult, children need that. They need that safe environment to feel comfortable and feel secure. When you feel secure, you grow. You're more willing to learn and explore. We want to help kids when they're sad, help comfort them and show them that they're okay. We want to talk about feelings. That's a really big thing, encouraging them to speak on their feelings, especially when they're little, kind of labeling that feeling. So when a child is acting up and throwing, like maybe say, it sounds like you're frustrated, or are you angry, like helping them understand that feeling. And that's also important too for us as well, because if we're angry and just saying like, hey, I'm angry with you, or because you're acting this way, that helps them understand what that actually means. And then making friends is also important. Children like us need social support and social networks to feel connected to the world around them. So help kids make friends by having those play dates, going to the park where they're encouraged to interact with other children. It's actually really beneficial for children to play with kids of different ages. Again, learning how to problem solve, how to get along with others, that all comes from playing with different kids of different ages as well. But understanding too their developmental needs. So a 2-year-old doesn't really understand sharing yet, but helping them learn that. Spending time together as a family. That's the number one thing in a child's life is their family. That's their first connections. That's their first friends. And so making sure that we have that time together, and then teaching them how to share, how to be kind and help others. And then teaching them how to talk when we have disagreements, kind of going back to that labeling those feelings. So you can tell your child, like, I'm frustrated with you because of this, but that doesn't change how I feel about you or how much I love you. So they understand that we can be mad, but we can also still get along and still love each other. Um, and their best and most important example does come from you, and remembering that whatever we model, our kids are going to learn. So then helping them learn and grow, right? So that's, the reading, the teaching them those skills. So reading books is perfect for children. Not only does it build that comfort level of, that quality bonding time, but also it helps increase their language skills. I don't remember the exact number, but I think it's like over 100 more words are known to a child whose parents read to them regularly than those whose parents do not sit and read with them. Making sure your kid goes to school every day if they're at the age of appropriateness. Um, Helping them with their homework. And like sitting down and showing them that you do care about their education, and that will help them as well and be encouraged to do well in school and go further. Plus, when kids learn something new, what do they want to do? They want to come home and share it with their family. So, being there, listening to them. Giving kids lots of different toys and games. And when we think about toys, it's not those electric toys that tell us what to do. It's just a set of blocks or, like a doll or something like that, like cooking toys. Things that they can model their environment with, but also they can model themselves, like Legos. They can build something and kind of, again, explore and learn on their own. And you want to encourage them to play and draw and sing, just developing all those talents that we have. And then it comes down to like doing what's right. So what is right for children? Teaching them values, the good of honesty, kindness, being responsible. Again, that's where you come back to showing, not telling. So if you're honest with them, if you're responsible, they learn that, setting that good example and being honest with your kids. Teaching them about our culture. It's very important for kids to have a sense of who they are and what makes them unique. And so the culture is a huge piece of that. That might be your religious beliefs. That might be a different cultural background from a different country, or even just a different part of our own country. There's different cultural practices. And so really, sitting down and explaining, like, we eat this certain food because of this, or we celebrate this holiday or this tradition because of this, and giving them an understanding of who they are. And when we have an innate sense of who we are, we grow up more secure with ourselves, and then we're more positive, and we don't have as much struggles with those conditions like depression, anxiety, because we have that firm foundation. So then, what happens when a kid gets sick? No one wants to see their child get sick, right? That's the worst thing. So it's important just to stay calm, like, stay calm and reassuring that it's okay, we'll get better, especially if it's just minor things, making sure they drink lots of fluids, keeping them hydrated, and smaller, easy to digest meals. There's something called the BRAT diet, so bananas, rice, apples, and toast. Those are bland foods that are really good for when a kid's sick. And typically they're things that they would eat anyways. Carbs that will help, keep their energy up. If they do have a fever, it is okay to try Tylenol or ibuprofen. But baths are actually really helpful too. Just giving them a cool bath, that'll help cool the body down. But remember, a rule of thumb is if the fever gets to about 104, you should seek medical attention right away. That's way too high for a child and adult as well. Keep them in light clothing to help kind of lower that temperature, or using a light blanket if they're cold. Some people do like to wait for the fever to break on its own and not, give the Tylenol or ibuprofen, and that's fine. That's where that warm bath would come in, cool fluids, lighter clothing, if they're young, in a diaper or underwear, and just kind of letting the body run its course. That's okay too, but again, make sure you monitor that temperature to make sure it doesn't hit 104. Coughs and colds, they're common. We talk about flu season, cold season. So making sure, or not making sure, but it's good to have a humidifier in their room that helps with the moist air to help breathing and loosen up the phlegm in the lungs, or stuffy noses. Just the little things. You can do saline drops or nasal spray if your child allows. And then if they're over a year, you can use honey to help with that sore throat, and it can help with cold, cough as well. There's natural antibacterial, antimicrobials in honey to help. but it has to be over a year. Under a year, it's dangerous because there's that risk for um, bacteria that could harm the child, and they don't have the immune system yet to handle that. Okay. So then, what if they cut themselves? Like kind of cleaning the wound, making sure that it's cleaned well with warm water, soap, and then if it needs a bandage, that kind of put a bandage on. If it's looking really deep, then again, probably seek medical care, just to make sure. If they skin their knees, that kind of thing, again, wash with warm water. If a child gets burned, whether that be, accidental on like a stove or something, or just sunburn, monitoring that. If it's, creams for sunburn, like the aloe or that, or if it's like a deeper burn, then seeking medical care to make sure that, it is evaluated and it doesn't need further attention. Broken bones or sprains. So kind of evaluating that, making sure that you stabilize it and ice it right away. You want to ensure that there's no broken skin. If there is, then immediately seek care. And then see if they, if they can move it okay. And if they can't, again, it's always good just to go in if you're unsure. There's nothing wrong with that, and there's no shame in going in. If you feel that your child's had inhaled something or ingested something they shouldn't eat, call poison control, and follow the instructions that they give you. Allergies. So kids have allergies just like adults. If they have an allergic reaction and it's just an itchy topical skin thing, you can put on that cream. Or a rash. If it starts to be shortness of breath or that they're really struggling, then I would call for help or take them in. Something that's been, we talked earlier about how it's important for kids to get outdoors. Making sure that they went outdoors, not getting too warm. So kids should play outside as much as possible, but on hot and humid days, they can get overheated quickly. And so encouraging them to drink fluids throughout that time, and just monitoring them. Like, are they feeling dizzy or sick? Then you want to move them into a cool place and do things to cool them down. Give them water, and then if they start to, sometimes if a baby gets, or a child gets too hot, they can have what's called a febrile seizure, or then you'd want to seek help for that as well. But yeah, so making sure that they're not too warm. I mean, think about popsicles, ice, lemonade, those kind of things that we all love in the summer. And again, like I said earlier, it's okay to call for help. It's better to be safe than sorry. And if you have any questions, you can call the nurse call line too. They're also available. So just calling that local hospital number and seeing what they have. So some other minor things that might affect a child, especially when they're little, is like such things as vomiting or diarrhea. Again, that hydration is really important. So just making sure that they're hydrated, and going back to what that brat diet we talked about. So the bananas, rice, applesauce, and toast. They're just bland foods that seem to not upset the stomach, and also kids will eat them and they give energy. Otherwise, just plain crackers, that kind of stuff as well. But again, with that one, you want to look for dehydration signs. So that would be the dry mouth or not using the bathroom for long periods of time. So if you only have one wet diaper all day, that's a warning sign. And so you would want to talk with or call the provider, because your child would probably need fluids, or they're feeling lethargic, they're not as active, something to kind of keep an eye on as well. Rashes, again, we kind of talked about earlier, so that itch, that cream, if it's itchy or sometimes cold on, even bug bites, putting an ice cube on can help lower that histamine or that immune response, and that will help with the itchiness. Earaches, so if a child complains of their ear hurting, you don't necessarily have to run to the doctor. You could do things like warm compress, the Tylenol, ibuprofen, and just seeing if in a day or two, if that's not getting better, then I would seek the medical care. But it's kind of something you can treat at home yourself a little bit. So you could try that. And then, basics, right? Hand washing. It's always important to wash your hands after we go to the bathroom, before we eat, after we come inside from playing outdoors, to just ensure that we're wiping away the germs and kind of helping with preventing those diseases. So other basic first aid skills would be, what happens if you come upon a child who is unresponsive, okay? So you think about, like, first things first is really checking the area. We want to make sure that we're safe too. We can't help someone if we're going to get injured ourselves. Think about, like, on an airplane, like, we put on our mask before we put it on our child's, because how can we help them if we can't breathe, right? So same thing with first aid for adults and children. So checking the area, making sure that the scene is safe, and then you want to call for help right away first. It seems counterintuitive, right? You want to make sure you're helping that child as much as possible quickly, but we don't know what they all need, so that's why it's important to call for help first, and then help the child. So, and if you're not, if there's other people around, you can yell for help, and then they will, have them call for help while you start assessing the child. So you want to gently tap them, like, hey, how are you? Hey, can you respond? Like that kind of thing. And then from there, if they're not responding and not waking up or moving, then you'd want to right away start CPR. So it stands for cardiopulmonary resuscitation. And so with that is where you put your hands on their chest like this, and you want to feel right between the breastbone, and you'll push down as hard as you can. You'll probably hear some ribs cracking, but that means you're doing it right. And so the rule of thumb is 30 to 2 breaths. So a good rhythm, ironically, is the Staying Alive song. So the Staying Alive, that's the rhythm you want to go to. So that would be, like, that's the perfect amount of rhythm. And then, like I said, you want to push hard enough to unfortunately hear those ribs crack. Then you're doing it right. And then you want to get about 100 to 200 compressions a minute. And if you forget the breaths, that's okay, because as long as you're getting that blood moving through the heart, there's still oxygen going to the organs. But really focus on that rhythm and that get that song Staying Alive stuck in your head. And with the child, specifically babies, what you're going to do is you're going to curve your hands around their chest and use your thumbs to push. And again, that one we would actually do 15 to 2. So cut it in half. Same rhythm, but just making sure, again, squeezing, and because they're so little, that's why you can just use your thumbs like this. And then again, calling for help, and you want to continue doing that until help arrives. Okay, and so then next is, what if they're choking? So big thing with kids, they love to put things in their mouth, especially around that 6-month age where they're really starting to explore with their mouth, and the oral skills are coming and sensations. And so the first thing you want to do with a child is check and see if you can see what's in their mouth. If you can see it and kind of sweep it out, you want to do that. Kind of open their mouth, and then they do a finger sweep. So you want to hook and then sweep it out. And if you can't see it, then you'd want to start chest compressions again, like either chest compressions or a Heimlich. So on a baby, you would hold the baby like this, and you would do back blows like this, and then that would help dislodge it. And then you always want to see. You don't want to do a blind sweep, because then you could potentially knock it back into their throat. So kind of, if you see it, then sweep it. Otherwise, just continue to do those back blows. And for an older child over the age of 1, you could do the Heimlich. So that's where you would go right here, go behind them, and then push up like this. And that would help dislodge it. If, let's say, you do that and it's not coming out and they become responsive, that's where you'd want to lay them down, and you'd want to start those chest compressions again, until, call for help as well. And so again with that, so let's say you're doing a baby. So you do the back blows like this. The baby's not responding. It's not breathing. You'd flip them over and you'd do your 15 compressions, flip it around, back blow. And that would eventually dislodge it. And if it dislodges and they start breathing again, then that's fine. I would still have them evaluated afterwards just to make sure everything's okay. Um, just because it's always important, we don't have the trained eyes of a physician, and so they know what to look for. So what may seem fine to us, we might be missing something. So again, worst case, it's never a bad idea to call for help or go in and seek help.